game-changing discussions on the big ideas that shape our thinking. This is One2One.
Hello and welcome to One2One. My guest today is Dr. Kunle Hassan, founder and chairman of the Eye Foundation Hospital, one of Nigeria's leading specialist eye care institutions. Trained in both the United Kingdom and Nigeria, he has over decades advanced tertiary ophthalmic surgery and specialist training across Nigeria and West Africa. In 2025, he endowed a professorial chair of the Olabisi Onabanjo University, reinforcing his commitment to academic medicine and long-term institutional development. Dr. Hassan, welcome to One2One.
It's a pleasure. Thank you for inviting me.
Real pleasure, sir. So I'd like to talk to you about the Eye Foundation. So the Eye Foundation, in your opinion, was it built in response to a market gap, a systems failure, or was it mainly a personal calling?
Well, I think it's a combination of both. The whole things you see there's a gap somewhere you have to fill. I mean, I was a consultant in UK. From there, I moved to UI, to Saudi Arabia. I was hard in mind, and I could see that a lot can be achieved in Nigeria. I spoke to one of my professors, and he knew the Guinness Eye Hospital has been established in Nigeria, that maybe I can practice with my exposure in vitro retina. I can work with Guinness. So I came to Nigeria. I spoke to them at Guinness Hospital. Yes. And then that was understanding what I was saying. It's like you are coming here, I mean, you are from this, you are not part of the system. Even when I want to join, from a consultant to join, I was being asked to join as a senior registrar because I do not understand tropical eye diseases. And I said, we'll study all this. That's it. So those are the things that made me decide that, look, I have to create a system. And when I decided I was coming back home, I made good money from Saudi Arabia, but I put everything on. Equipment, what do we need to practice, the standard of practice. And what is my exit strategy? If I'm going to go to Nigeria, start something, I must have an exit strategy, of course. And within that short time that I started, I could see that the only thing I can do to really is to create an institution. And if you want to create an institution, then you must be prepared to pass the knowledge on by training people. Share that vision. A vision is not shared, or it's not a vision, it is shared by two or more people.
Absolutely.
How can I get those guys that are still young to buy into that vision and create an institution? So I spoke to some of my colleagues overseas, and I spoke to some of my colleagues here. I tried to form a group practice, try to see the younger ones that are a little bit, but nobody believed in it. So I decided the only way I can do is to start training and train them young. When their mind is open. Sure. And that's why I decided, okay, I must start a residency program.
At the Eye Foundation?
Yes. So that helped us to create a vision of training, getting the skill to the younger generation, get them into subspecialties, raise the bar. And we wouldn't stop there alone. Because how do we get these guys well trained? We started doing outreach.
Camps.
We take our microscopes, we go to Kaduna, Kano, Benin, Akure. We're all over the country doing outreach and giving sight to the less privileged. Sometimes in a weekend, we will do 100 cataract surgeries. and see what we're doing, I make sure that the supply chain must be protected. And to have access to that, we created sister companies in pharmaceutical and also who are distributors for the biomed and the equipments. So we build the credibility, we could have the equipments, we can have the drugs flowing and all these things.
You locked it down.
Yeah. So by doing that, we were able to control and create the standard that we wanted.
Of course. And at what point did you realize that your surgical skill was not enough, but it was governance actually that was going to determine your survival?
Exactly. As doctors, we were not trained to look at those key factors of governance. We just think, I do this, I do. Doctors have a chip over their shoulder.
Oh, yes.
We were not really. But when I saw that, I was able to learn that this must be different. So what I did is I approached some of my like Elijah Okuno, Chike Wanze, those guys were in industry, Pastor Dozes, all those. I approached them. And I say, sir, can we form a non-governmental body, purely Eye Foundation Center for Prevention of Blindness, to take care of this and separate it from the whole organization? And that's what we did. Yes. With that pulls in some resources from those guys to see effectively what we're doing.
Of course.
And we were going to where nobody, all this Bejuleki you're seeing now, Dangote did this. In those days, there's no way there you go by boat, you go this, right. There was no health care. We were there doing the eye care. Supported by people like Alayoko was the deputy governor then and all these things. And we were doing a lot. In response to that, the Lagos State acknowledged it and gave us a place in GRIC next to the Civil Servants Club to start doing. That's how we started that, and that's where we use for the less privileged. As we do this, providing facilities for the less privileged, we need also I always tell my colleagues, we're not doing them a favor. Don't see them as poor, you're doing a favor. They are part of the ecosystem for you to get trained.
Yeah.
The volume is going to come from them. We will share our private patient with you for training,
yes.
But this is the pool. So we saw the vision in a social enterprise system whereby you create a pyramid. The top of the pyramid provide all the resources that will percolate to the bottom of that pyramid. And that's what the volume is.
Yes.
Until you're able to get that economy of scale whereby the volume is large enough that it becomes self-sustainable. So we saw that. And that's how we started, okay, what can we do? That's what led to creating the Ijebu Hospital. We look at Ogun State with the 3 million population and saw that and create that center in Ijebu. And we were lucky, the Abuja was good. We got a 12 acres of land and we built something. And that becomes our primary training center, creating the bond. So people are coming. We have outreach to the villages and all these things. Even we bus them into the hospital for surgery. Sure. So, and because of the papers we were pushing out at the international conferences and all these things, they were looking at us. Is this from Africa? Is this real? Are you getting money from social? I said, no, it's a social enterprise system. We don't get money from anybody. But we use what the rich are paying to help the poor.
Yes.
And so when we presented a lot of papers at the academy, at the Royal College conferences, they got interested in a model. So that model sparkled that if an indigenous organization can run that sort of sustainable program without asking for help from this or that, it will be very, very successful. It will be great to replicate.
To replicate it, yes.
So then at the presentation at the international meetings, one guy came, his name is David Graham, and the president of the International Agency for Prevention of Blindness actually called me. Kunle, let's look at this process. Is it true? Well, look at it. And they created what they call the I Fund. The I Fund is a $20 million fund underwritten by Probaco, the French Federal Agency Development,
GFI.
the American OIC, and others, that we will give this fund to less privileged area in Asia, in Africa, and this. And then at 6% interest rate for 7 years. They will pay at the end of 7 years. So this was put together, and we look at it. Coincidentally, you see, as luck we have it, MTN Foundation got interested in what we're doing. They want to do 2,000 cataract surgery over 6 geopolitical zone. We did it. Diamond Bank got interested in what we did. We did it. So one day, Pascal Doze called me. He would like to have lunch with me. I said, okay, dinner with you. And he said, Kunle, I'm leaving Diamond Bank. Can you be on the board of Diamond Bank? I said, I'm not a banker. He said, no, I've known you for 10 years. When you're my friend, you never asked me for a loan. I said, I don't think I. He said, 2, I want people who can be on that board, look straight in the boy's eyes, and watch you and do this.
Yes, of course.
And that was how I found myself in the finance.
Of course.
And I was there for 11 years as a non-executive director.
Huge experience.
And I also was there to the level of being the chairman of the governance committee. And you go a lot of courses to Lausanne, to Harvard, and all these courses. So that exposure gave me a better understanding of how to create processes that leads to system that works, and that system leads to creating an institution.
Of course. So here you are at this point that we've reached in the conversation. You are an institution builder. You're sitting on top of a thriving private organization running a social enterprise. You're signaling to international development finance institutions and attracting funding. You're serving private practice, and you're also serving the non-privileged. And, oh yes, by now you're seated on the board of Diamond Bank. So you've attained quite a stature by this point. But I want us to hold all of this and think about the way medicine and clinical practices generally run in this country. Think about founder-led hospitals, like the Eye Foundation, maybe not like the Eye Foundation. They remain very personality-driven, do they not? You've obviously avoided that trap. And I'm going to try to ensure that we don't take that for granted. Can you tell me precisely how you avoided that trap? Or at what point you decided, because it sounds like a conscious decision, that you were going to avoid that trap?
Yeah, thanks for that question. I sat down and studied the dynamics of creating institutions in healthcare. If you see those institutions, the broader looking that's evolved, there's somebody who's paying the price as a founder and also must have a big heart to let go and let that thing get bigger and reach a situation whereby it will perpetuate itself. And the strength of that is, as I first mentioned, is to plan your exit. If you say you're creating a hospital and you don't plan how you're going to remain yourself off that hospital, that without that hospital, you can survive. And the investment in that institution in healthcare is not like investment in other area routes and all these things. It must circulate within that system, because healthcare changes require more equipment, and the guys that are going to run it, you must be able to enable them to earn enough to be able to maintain their lifestyle, send their children to good education, good school, and have a roof over their head. If they cannot achieve that within that system you are creating, and you cannot use that system to help them grow towards their vision, you watch them go. And that institution will collapse. So it's to be ready that the discipline you're going to put into it, the leadership you're going to put in it, is got to percolate, and those you're training to take over must believe, must be able to earn, must be able to say, I'm this institution. Like I always tell my guys, we are nothing outside our foundation. You're a medical director, you're a consultant, you're this is the institution. If you're out of the institution, that's it. But you will feel it if it's a good institution and you're out of it. But if it's a bad institution and you can't see your benefit, you're out of it, you have nothing to lose. You try to get your interest in another way. So we have a culture, and we treated that culture that you must be prepared to give part of you to help the needy. 2, you must be able to work for yourself. I personally do not believe you can pay doctors. I always say it. The moment you say this is the salary I'm going to pay a doctor, forget it. That money is gone. So I believe in a system whereby this is the institution. We who are practicing that have our own group practice. Like in our foundation, we call ourselves associates, they are consultants. And you must have got your fellowship, you must have got your subspecialty before we invite you to join that associate consultant. The institution itself will run. But we that are working there, we must get our fees.
Yes.
You create the wealth, you share the wealth. And once you we create the wealth and share the wealth. So you are working for yourself. You're a business unit within the business.
There's a stake.
And if all of us depends on a viable institution, if we can't, we must contribute it. I always say, we don't have to be friends to work together in a place, but we have a common interest. And that common interest is survival of the institution where we work, the ethics, the everything. Oh, people say, oh, when they earn their fees. What if they do not decide to do things that are not proper, unethical, in order to say, look, I always tell my colleague, make your name first. The money will follow you. When I was the one that started our foundation, everybody wants to see me, which is a normal thing. Yeah. When all these guys, once they pass their fellowship, they do these things, I work with them. 6 months. We share the fee. When my patient can say, oh, when you see Dr. So, well, we share the fee. And I moved up. My consultation then was just about 1,000 naira. I moved my consultation to 5,000. So a lot of people are like, but these are the doctors, these are my colleagues, we work together. You
can see them.
And when they see them, next time I say, doc, we are happy. And when is this, I move on to 10. I don't want to see more than 50 patients when they're low. And this is how we help them to build. And we also constantly audit what we're doing. We have clinical audits, we have surgical audits, and we, every day up to now, the first thing post-op, you see it in our IT system, the visual acuity pre-op, post-op, everything. And we discuss it openly. So it's be part of the culture. If there's no comorbidity, and this guy came with this, and the result is this. Why? The WHO standard is that 80% of a case must be above 618. Why? I said they're comorbidity. So it becomes part of the culture for excellence and all this. And that is why along the line, Hilton Foundation, Aravind Hospital in India, and John Hopkins work with us to claim our institution in 5 places in Sub-Saharan Africa. For 10 years, in Kenya, Zambia, and Ethiopia. And we work together and create center of excellence for cataract surgeons and measure those standards. So when the guidelines that you must fulfill to be able to get that recognition on the WHO standard, and there is the Aravind that will mentor you on systems, and then there's John Hopkins who will evaluate all the processes. And we go around and all these things. Then the processes are there, you follow it, it creates a good system, and the system sustains the institution.
Absolutely.
So the fundamentals must be there. And that's what is not the most Nigerian hospital. That is what I always tell my colleagues, when we were doing this, some of my colleagues say, how could I get it that your boys are earning more than you do? I just smile. I say, why not? When I bought my own property, first property was 15 million naira. For them to have that property now, they have to earn about 150.
Yes, quite.
I have a roof over my head. My kids are no more in school. These guys have to achieve the same. And the only way you get to achieve the same is to ensure that the system provides the opportunity for them that if they're good, have the skill, have the mannerism and what it takes to be a good doctor, they will survive.
Absolutely. I'd like to move on to the question of capital, discipline, and infrastructure. Specialist eye care is, of course, equipment intensive. How did you approach the question of capital allocation, especially the volatile macroeconomic environment such as we are existing in this country?
I was having a chat with my son and my daughter, who's an ophthalmologist. We just they asked this sort of question. Dad, I said, look, let me tell you. I've been through a time in Nigeria where things works. And what drives it is discipline and honesty. I've been in a process overseas where things works. People will like you for what you are and give you the opportunity to be the best yourself.
Yes.
It's quite a different story now because they're different dynamics.
Yes, quite.
So I was lucky to be in a good system that works in my country, to be in a good system that works overseas and can compare the two, and therefore my mindset is quite different. So coming back to Nigeria, things have changed. Values are different. But within it, I was telling you can create a space for yourself. You look at the system, this is where I'm going. These are the external forces that can distort how I get there. If I put this effort in a good environment, I can earn 100%. But if with all these diversions, I can achieve 60%, I better target that 60%. So in your own system, create your processes within your system, create your system, create your goal, and work towards it. And make sure that the people that you're carrying along share that vision and they can see light at the end of the tunnel. As we are getting bigger, the cake gets smaller, isn't it?
Of course.
Because of number. But as I was mentioning to you, we were able to qualify to tap into the iPhone. The supply chain is secure. Now, to scale up with the sort of equipment you need and all these things, and with the interest rate and the banks, there's no way. So, but due to our focus on providing evidence-based progress that is unbelievable to the people when you present internationally, compared with what is coming from East Africa, the aid something, and this is a system that works without support. We're able to tap into the iPhone. And Deutsche Bank and Ashoka Investment, a part of Deutsche Bank, came to Nigeria, spoke to all our directors, to the banks and all these things. And they could see the level of governance in a system, and they could see the sort of people who's on our board. They were able to give us $7 million loan out of that $20 million. And they look at us and say, we want the social impact, we want the quarterly report, and all these things. We know they say Nigerians don't pay, but we believe the system you are creating, you can do it.
So governance and excellence and institutionalization shielded you really from the vagaries as the external finance.
So when they do their due diligence and this, and they gave us that money, first of all, I look at if we domicile this money and exchange ratio balloon, how are we going to? So the first year, I edge. Keep the dollar at 8% interest rate given to us and take a loan at 12%, using 4% to edge. But within a year, I could see that I'm losing almost 61 million to edge. Yeah. Where's this? So
bring good money after that.
Bring good money back and look at it, capital importation at 112 and this. And I told the bank, you want us to pay back at 7 years. I don't want 7 years. I know my age at that time. I don't want to pay. Give us 3 years moratorium and let's pay. Capital. I guess that they have 7 years to go for $7 million. We were the only one they agreed for. The others in China and also India was 7 years. So out of this fund, $5 million was used to develop the private sector. 2 was used to develop the social enterprise, the biggest hospital we have in Ijebu, which is 102 bed. Beautiful place. The private sector pay for that loan. The fixed assets are there. As in the economy of scale, the volume, now they are self-sustaining. They pay everything. So what we have here, we make sure we invest it in equipment, this, and the good strength of the organization is human resources.
Absolutely.
We pay the price. We lay the foundation for human resources, doctors, optometrists. So we were training those, so it's easy to duplicate, to clone the system.
Absolutely.
Luxury, no. I came back to this country. I had no car when I was using my wife's car. What do I need? It's a liability. I better put this money.
It is a liability.
Yes.
Indeed.
I said I better put this money in what can yield. And we did. Now, if I want to ride a car, I can afford to do it.
Yes.
But I would have killed that opportunity. A lot of them divert the funds into estate, into big life, into this. They don't bring anything.
Yes.
But when you know where you're going and you can create a multiple source of revenue, not just, you look at the value chain, there's optical, there's drugs, there's this. You look at those value retail chains, those are the ones that turns of, when you look at the clinic as part of it itself, it's quite intensive and the returns is not as great as those ratings that surround it.
Absolutely.
So you got to look at this and
Yeah.
So this is how we look at the system, create the financial model, and make sure that we're on top.
Absolutely. Yeah.
By the time we've created all this, we started with one single room in Ribadu Road. We have 15 hospitals now. We have about 7 tertiary institutions. We have about 5 secondary, and then the other. So with those institutions having multiple running as a unit, a business unit, and constantly having meetings to assess what is going on. And everybody within the system is taken care of.
Absolutely.
The performance evaluation, you're these days with this, you're worried about your guys. This guy at the stage must have a roof over his head. What can the system do to make it, and that's sort of create a comradeship within the system like brothers.
So talk to me about how you go about step by step ensuring that surgical standards are uniform across all of these multiple locations that you have.
The strength, as I mentioned, is the human resources. All the consultants are resident. There's no consultant in an institution that is not my resident, and they're trained in the system. So the culture, the mindset, and those along the line where we're training them, when we see those who are mischaps, they can't, we ease them out. And they know that when in the system they were protected. We run a transparent system. Everybody knows what goes in, what's coming in, and we run subspecialty. Is this subspecialty, you require the highest level of technology. We provide it. And most of those equipments now, 2-3 years, the software changes and all these changes. So we build it into the system. You want a vitrectomy? Fine. A vitrectomy costs almost 5-7, But the same surgery overseas costs $15,000 to $30,000. You're using the same thing, you're using the same consumable. But we have to say, okay, we got this machine, what is the volume we're doing? If this volume 1, within 3 years, this machine is obsolete.
Yeah.
You know that. Now, we need a replacement within 3 years. We need a profit 3 years. So, 3 times the value of the machine.
Yeah.
How many patients will I see within this period to make that 3 times?
Factoring in the replacement cost.
The cost
as well.
and the profit into it. Because, and also the maintenance. A lot of these things you just link up. And we have biomedical engineer trained. That's why we invested in being part of the distributors.
Yeah, of course.
So that reduces the cost of maintaining those things. And we said those guys are about to learn. Now, when you look at that, that determines your price. If I can do 1,000 to get this within a year, get my money back. So I need 3,000 to fulfill that. What if I stretch myself and I can get 5,000? It brings the value. Since the skill is skills.
Yeah.
So if you're not constantly looking at that and looking at the maintenance cost, the culture, we train those who handle a machine and so on. Call them ophthalmic practitioners. And that's the job, and the annual. So everybody see, we must protect this thing.
Yes.
And the other one that makes for certain high-tech surgeries, the turnaround. If your machine breaks now, even the best, to get that guy from India, from UK, from the turnaround. So some of these machines, we have to have 5-6 of them in all the units. We didn't need to have that 5-6 of them. But we know that we want breaks down. They said turnaround of 2 to 3 months.
Of course.
What happened?
It is business.
So we make sure either you go from BK, you go to Lekki, you can have the surgery there. We know there's one in Abuja, and the volume is not this. What is this? Is this to ask 5 people to travel to Abuja, to Lagos, to move the machines around?
Absolutely.
So you have to, you mentioned about the risk. This is the risk of high-tech institutions.
Of course. Of course.
If you look at a system here, if you look in Lagos, how many CT scans, how many MRIs?
Too many.
There are just too many. But if the whole of North England, they go to Arrow, they dock their this machine, the next is dock another place.
Absolutely.
Why can't we listen to those guys who have the knowledge and coordinate these things and make it a win-win situation for everybody?
Yeah.
So there's governance issue, there's mindset, and that's ego name issue.
Yes.
But I still see it that the final solution, when the healthcare is going to change in this country, it depends on the doctors. When the doctors start seeing themselves that they are head of the team, and they have to create the right environment. Politicians, ministers, all these guys, they don't care about others. But when the guy can sit down and say, look, imagine if the top doctors in this country get together and create something with good governance and everything, people will key in. But we are sometimes our worst enemy. We want to pay for talents. We want to pay for it. You can't pay for it. That's what I mean. You can't pay it up.
No, you certainly can't.
So we need to have a change in mindset. Now, when we are looking at our financial system, when it's coming to December to January, we have to make provisions because the number of patients goes down. We have to make provision to cover all these sick costs.
Sure.
So we move our end of our financial years to 15th. So we know from 15th to January 15th is a dull time. Everybody on holidays and this. But now it's changing. A lot of people are coming from Canada, from the US to come and have their surgery in Nigeria. Because even though their co-payment, they see that they still get a better things. That's because we are providing a skill of high standard and rewarding people for that skill. Whatever guy Okonko is your friend. He was invited by Oxford as a listening professor. Their-in-law is on many board, on many international board, all these go. We encourage them to be the best of themselves.
So do you think, therefore, given the talent pool that you have curated and everything you've discussed here, do you think it's possible, therefore, to build a world-class surgical center as you have built, but without global migration exposure? If these guys never had the opportunity to go, I mean, we talk a lot about the japa syndrome. Is it possible at all to build this without that exposure?
Look, it's possible. Those guys that we're talking about japa syndrome, they're saying the limitations now.
Exactly.
Look, it's a system. You have to understand how the world politics works. An average British guy know how much they will train to put in training doctors. Because they themselves are not getting satisfaction and no compensation, their doctors are migrating to Australia, they're migrating to US. So how would they replace them? So look at Africa, where you can just put £5,000 and they will come. To them, there's a lot. However, by the time you lock them in, they discover that they pay tax, which they pay VAT. They want to, even what they pay for a house rent, not to talk about the mortgage. So they are locked in. And what are they saying? I'm doing it for my children. And I always tell them, no, you're not doing it for your children. Because those your children, if you don't live in a good place where there's good schools, they cannot go to public schools. They go with touts and people who introduce them to drugs and things. So you have to prepare them for private institution. And you have to pay for that. There's a premium for that. But if you live in a good area with all these facilities, there's also, you pay
Absolutely. To exist in that.
to assist in that department. So why can't we look back home and create that sort of thing? Why do we allow politicians? We know people say that healthcare do not belong to the doctors alone. It belongs to the policymaker. But this, that is true. But you must put yourself in a position to influence those policymakers. I would tell you an example of my experience. I'm not always prepared to work with the government. But when the governor of Ogun State called me, that place, I want you to be the chairman of Olabisi Onabanjo Teaching Hospital. I told him I would get back to him. Because we are different mindsets. But the later Ojale called me and said, actually, you have to do something for us. I said, okay, sir. And we went, and the brilliant boys like Sano Gunjimi, Asuni, all these guys from private sectors, they're on that board. So they gonna pick a good board. We're not here to eat. And we got there. The first 3 months, it tends to be around that COVID period. The first 3 months, we're doing situational analysis. They look at it at government sustainability model. We throw away the government out of it. We look at it as this institution got enough to create IGR and sustain itself without the government. If the government is providing the salary, that's okay. But to run the system, after 3 months, we spoke to the governor that we want to meet the ESCO and we present that bill. And we told the government, release the IGR of that institution from us to us. We'll not ask you for a pen. We turn the institution around. He look at us. The ministry, they don't want to let go, but the man decided to believe in us and he gave us. You go to that institution today, it's a different institution. Of course. We changed the whole government beds, we changed everything. It's got the best trauma center in this country. And why? Adego Papa Biggie built a 2 billion trauma center. You go into it, everything is there.
Who's that?
The CT scan on the baseline, all these things. People have confidence. They see what we're doing. The IGR that was going between 30, 40 million, we stopped money collection. We asked Pay One to collect. So the IGR now goes between 200 to 300 million.
So it's a good time to talk about your professorial chair in ophthalmology at the Olabisi Onabanjo University. So you endowed the professorial chair recently. Why was that important for you at this stage in your career?
We always look at what is the next stage. We've got the peak, we've established what is the next. The real strength of any discipline is what percentage of your population is getting the bait. How easy is it for you to scale? We tried it with Luth. They rebuffed us. So we keep training. Now we got to the level whereby we have enough funds to establish professorial chair.
500 million naira, I believe.
Yes. It's something we've been putting in escrow account for long. We have enough now to establish the International Institute of High Health. And people start doing BSc, masters, and PhD and research. The multiplying effect of that is what drives our interest. If we're training, lock in the system 100 to 120 high healthcare professionals, and part of their clinical experience, they can get it from the community. Do you see how many we can release into the different rural communities for data collection and train them so that the doctors, all they do is provide the support, technical support, do the investigations, the doctors just do the surgery. The multiplying effect will be here. The cost of providing services will be lower. And when those guys get a degree, Nigeria is a place where they love degree. When they get the degree, their families are happy.
Yes.
Already we are trained with the College of Health Technologies and Polytechnic, what we call the ophthalmic practitioners. They go in with 5 credits, they take them, they get the OND, and we even get them accredited by international joints, IJACAPO, middle manpower level in ophthalmology. They understand all the procedures and everything. These guys, because they haven't got a BSc degree, they cannot go into other public systems. Despite that, teaching hospital all of us send them for those courses. So this is a way for us to now get to their critical level, whereby the impact of an institution can be felt all across the country, all across West Africa. People can come from those degrees and all these things, and demystify the eye health delivery system.
Yes.
And be able to see the importance of primary health care center. There's no sense we've been trying to graft primary eye care on primary health. It's been tough. Despite the fact that we provide us, they leave. But if there's a streamful of human resources that these guys are coming out of school, they're going to this is part of their program and all these things, it will thrive. It will continue to be there, standard will be there, and then we can move to the next level.
Yes.
So I'm always focusing on the long-term effect. That thing the universities cannot achieve on their own through the public, we will drive it.
That's it. And that's quite a commitment, isn't it? 500 million naira for starters in that endowment. And we talked earlier about the issues perhaps around personality-led founder institutions. You obviously are an institution builder. There's no doubt about it. You've obviously done a huge amount to build that institutional position you have now on behalf of yourself and the Eye Foundation. I'd like to ask, in a trust-based profession, which is what medicine is, what erodes that institutional credibility fastest? What is it that keeps you awake at night, having built all of this?
What keeps me awake at night is when I'm not there, what will happen? And therefore, I made everything possible to replicate myself, to clone myself. If I get 3 out of 10, make sure they have the belief, look at their strength, and let them play to the best of their ability according to their strength. And create a pathway for those who can maintain that standard and continuity. All our hospitals, we have medical directors. And those medical directors are selective based on their ability and reason. There's some of them with very good business acumen. There's some of them with fantastic academic excellence. But when it comes to business, forget it. So it's to identify the talent in each and put a round peg in a round hole and create that synergy among them. The system will run.
Yeah. So let's look, therefore, as we draw to a close, at the future of specialist healthcare and eye care. How do you feel that artificial intelligence will reshape ophthalmology in Nigeria going forward?
Well, we are investing in it, okay? But healthcare is where artificial intelligence cannot take over human decisions. Artificial intelligence will help to gather, what you take you long time to, gather informations are available, things are there, but it's got to be processed. 80, maybe 10 to 15% of what you get from artificial are probability that may not even relate to the core faith. So you've got to save it. We're using it in patient appointment, getting the best, like auditing your processes and all these things. They're really helpful. And we're investing in it. But when it comes to, and also help you with clinical management in terms of
evidence-based.
yes.
Yeah.
But at the end of the day, it's to make your life easy, to make a better decision.
Absolutely.
But it will not make the final decision for you.
No. And it will not operate upon the patient.
Will operate the patient, exactly. So it's a function of efficiency. Shorten the time to get those things together and also can help you to audit yourself. And also give you ability to compare with peer groups and what is happening in other part of the country and see where you're going through. And one thing that has helped us a lot is to find out the response of patients in different culture and different ethnicities and to surgical results. We look at the eye, there are differences. If you look at most of the autorefractor, you say, oh, they check your eye with automatic something. The logarithm is of an Asian eye, not an African eye. So when you use it to do an African eye, you have to do subjective and get it. So can we start, it will help us to start collecting data.
Absolutely.
And because it's difficult, you write to these people, they cannot answer you. But once that thing enters the system, it can aggregate them and get you. So it's going to help us to start doing things that will help our own ethnicity. So
Yeah.
It's beautiful.
And talking about eye care and public health, from a policy perspective, what must Nigeria get right in the next decade to eliminate avoidable blindness at scale?
That is the key thing, avoidable blindness. The avoidable blindness will increase with age. Most people is cataract. Everybody will get cataract at an age. So it's to put a system in place. I once discussed this issue when Governor Mozu was the governor of Ogun State. And we running a scheme whereby with 5,000 naira, we can provide cataract surgery anywhere in Ogun State for the indigents. They thought it's not possible. We look at it. It's an economy of scale. The volume, the things we get. If you are the intraocular implant we put in the eye, you buy a single one, the cheapest one is about $20 to $40. But when we order for 50,000. Is that $1.50? Scale. So it's to be able to define the policy and look at the strategic plan must be such that in implementing those policies, the right things are in place and help to educate the mindset of the professionals who are doing it, that you are sitting on this guy because you want to get this money. But if you let go and let the pool be large, you will still make sense.
Sure, absolutely. So Dr. Hassan, if you were to summarize your life's work in one institutional principle, what would that principle be?
Just give your best, irrespective of the challenges before you. Integrity, empathy, and shared determination to succeed with a strong faith in God to guide what you want to do.
Absolutely. So you talked a lot in this conversation about institutionalization and governance and excellence, self-belief, belief in the country. I have to ask you at this point, has building or has choosing to build in Nigeria, in this country, strengthened your optimism or your realism?
Look, it works in both ways. The optimism drive the will for things to be realized. If I won't come back to this country and face this and create what has been created to the grace of God and through my colleagues believing in a vision and driving the vision, I won't have risen to the post I've been at. I've been at the highest level of ophthalmology. I was a member of the International Council of Ophthalmology. They usually change every 2 years. I was there for full 8 years. I've been given an award that's never been given by the Golden Apple Award. I was the first African to get that. And I've also been elevate a lot of Africans. The president created the African Ophthalmology Council against the wish of the Arabs, because before we were Middle East and Africa Council of Ophthalmology. But that is being exploited for resources. Our pioneer, we make sure today we have African Council of Ophthalmology. We have specialty, retina specialty, glaucoma specialty, and we are being listened to. Before, it is the foreigners who will be giving figures and things about Africa. Now we are directly on the seat, and they are gaining more respect. And the royal colleges find it necessary to collaborate. Before, they will ask you to do this, you can't do this, you do this, we give you this. No. But they see that Africans, ophthalmology, have discovered themselves, and those in diaspora and in the country are working together to a high standard. They want to be part of it. Everybody wants to be part of a success story. So the greatest things in my life, I'm happy is I'm not only, God has been kind that I'm able to do this in my country, I'll be able to do it in Sub-Saharan Africa and lift a lot of people up in ophthalmology. Then now they talk to us at conferences with respect, and it puts a smile on my face. When I go during international conference and I see all those young guys, they go, oh, this. That is it. It's beyond what I hope for. And I'm happy that now my joy is where all these other people will work together, believe in that reason, where they're heading. They're going beyond me. They're all this. But at the end of the day, they always call you to say, thank you for being part of our life. And that's what gives you a smile.
Yeah.
It is.
Absolutely.
Yeah.
Dr. Kunle Hassan, thank you for joining us on One2One.
Thank you very much for having
Pleasure.
me. I appreciate it.
Thank you.